The postgraduate Speech and Language Sciences and Disorders Medical Speech Language Pathology Fellowship Program started in 1990. And the focus of the program was to educate new graduates on the medical aspects of our field. We're very proud of our program. The fellow is offered a variety of experiences, both pediatric and adult, and we also tailor it to the person's individual requests and needs after they've passed many of our competencies. So we also individualize it as well.
After I had completed my master's at Boston University, I wanted to come back home to Detroit, and of course I was looking for a large health system that would give me a variety of early experiences in my career, and Henry Ford has always had a reputable name and recognition nationally, and so I wanted to come for that. But at the same time, the unique opportunity to pursue a 2-year clinical fellowship really resonated with me.
My last year in grad school, I knew that I wanted to work with the adult population, and I knew that I wanted to work in a hospital setting. Specifically, I wanted the acute care experience, and a lot of students and a lot of speech pathologists know that getting a fellowship in that field in acute care is very difficult to come by. So I knew that it was something that I really wanted when I saw that Henry Ford offered that acute care fellowship.
So as part of the clinical fellowship program, we were required to go through 3 major rotations for pediatrics, outpatient, and then acute care. Going through that, and then in our first year, and then in our second year, we were able to specialize in our interest. So I specialized in dysphagia and pediatric swallowing. So I've used those skills throughout my career.
My heart is in healthcare, so I clearly knew from the very beginning that I wanted to be in healthcare and a medical speech language pathologist. So I looked up the top-notch hospitals in the country and applied and picked Henry Ford as my choice.
The fellowship was exceptional in terms of learning how to work with other people that are not in your own field. And having spent time in ENT and on neuro units and working with nurses and physicians in these intensive care units really helped me appreciate other disciplines and their perspective. The first year was designed for these various experiences and rotating through different practice areas. And the second year was an opportunity to specialize. And what I fell in love with was neonatal intensive care unit.
Once myself and my supervisors felt that I had acute care kind of under my belt and I understood the process of acute care, then I was allowed the opportunity to expand and see other areas of medical speech language pathology. One of my favorite things that I was able to do was the awake craniotomies, where we are in the OR with the neurosurgeons. We're doing speech and language mapping while the patient is awake, working with the neurosurgeons. So being able to have that opportunity was something that I was able to continue doing because I was lucky to be hired after the fellowship.
At my fellowship, I had access to a lot of resources, great clinicians, well-experienced clinicians, so who showed me by example how to lead as a clinician, how to supervise students. So I got a lot of, kind of lead by example. So I think that was really, really helpful to shape me as a supervisor and how I supervise students in their setting and set their expectations.
In terms of leadership, as part of the clinical fellowship program, we were required to design in-service programs and speak with other professional groups, social work, nursing, other physicians, to educate them on what speech-language pathologists do. I was also able to be part of some of the specialty operations in the department, such as continuing education. So getting experience in just contacting others and promoting ourselves as a profession was very valuable. I'd just say, the opportunity for this CF was invaluable then, and I think it's just as invaluable now.